All right, Gerri Willis is here with us earlier. She's back again now, and this idea that if you have Social Security and you're looking forward to maybe even a nominal increase, it looks very unlikely now. Usually that's the same crowd that's paying for Medicare, and the Medicare costs are rising precipitously. So Gerri back with us, Elizabeth MacDonald here, Charlie Gasparino, and Tevi Troy on these Medicare costs. First, Gerri, what are you hearing? How much of an increase? What are we looking at?
Look, we're looking at $600 on average. This is mostly going to what the Social Security Administration deems are wealthy folks. They'll be paying more.
$600 for
$600 additional a year.
Okay.
It could be more if you earn more. And 52% is the average hike in premiums for Medicare Part D. So this is what you pay when you go to see the doctor. This is just basic care that everybody wants. They're going to be paying more. Now, keep in mind, these are folks who have tried to take care of themselves, set money aside. They're trying to do the right thing. Now they're being penalized. Advantages they thought they would get through the federal government, they're not getting.
Is there a fix for this that they're working on, Tevi? What are you hearing?
Well, I am hearing that there is a fix, but it will cost money. And the fix is only needed for some people because there's legislation that says if there's no Social Security cost increase, then there should be no Medicare increase, except these people are not covered by that legislation. So you have typically with Medicare, some people benefit and some people don't. It's arbitrary depending on government rules.
Let me ask a 30,000-foot question. Because I keep reading in various liberal media outlets that the cost of health care has gone down dramatically.
I don't know where they get that.
What is going on here?
Doesn't look like
that. The rate of growth has declined. That's what's changed.
But does that factor in things like Medicare, premiums? Yeah. Does it factor in the cost of drugs? Because they have been skyrocketing.
Yes, we've seen individual drugs go through the roof, but not absolutely.
But the issue is with the the cost of living adjustment for Social Security discounts medical care costs in the index that they use to figure out Medicare premiums. So that's a CPIW. That's for urban workers. It basically discounts the medical care, and that's what Social Security, senior citizens. That's a lot. That's where a lot of the costs go.
Is any of this a fallout from Obamacare, or?
Well, Obamacare has raised prices across the board, in my view, and that's part of the problem.
Tevi?
Yeah, I agree with that. I mean, there has been some moderation in the rate of growth, but that is not due to Obamacare, according to the Congressional Budget Office. And I think that as Obamacare is more fully integrated into the economy, we're going to see even more cost hikes going forward.
What is the rate of growth? What is the reason for the rate of growth? Because this is a huge policy argument that's going on on the left, that people at Fox and other places, we're not really being truthful about Obamacare. What is causing the rate of growth then to decline?
The CBO says that the rate of growth moderation, again, it's still higher than overall inflation, but the rate of growth moderation is due mainly to the lingering effects of the recession. And we've not yet seen fully what happens when Obamacare is in there.
It's that simple. People are choosing not to go to the doctor.
Or because the deductibles are so high under Obamacare, they're not going to get medical care. And, the thing is, there's already talk right now, it's really unfair to seniors that they're using the wrong cost of living adjustment. They should use the index that's for senior citizen expenses, not for, urban workers' expenses. That's what the debate going on right now in Washington.
That's what the AARP is arguing right now. You got to change that out because seniors don't necessarily face the same cost as everybody else does.
I'm part of the AARP now.
You are? Newsflash.
For a good 10 years, right? I mean, it's been a while. Tevi, though, what I always want to know with this is now they're basing whatever the inflation rate is for as Gerri reported earlier, no increase at all. Why can't they use the same methodology then for the Medicare costs?
Well, the problem with the federal government and so many different programs is there's so many different methodologies, and this is what you see in all kinds of programs. For example, with the excise tax or the Cadillac tax, the rates of growth are going to mean that more and more people get covered over time. So when you have different indices that determine who gets covered when, you see different people covered, and you see these anomalies of coverage.
So the way most seniors pay their Medicare Part D premiums is right through their Social Security check. They have an automatic.
Part B, right?
And I mean Part B. Thanks for correcting
that's right.
me.
No, that's right.
So that's how they.
Extremely anal.
I know.
No, I just. I
thought
get
it right.
It's B.
Let's get it right.
Sure.
Is there a D?
Yes, there is.
For drugs.
Yeah.
That's for drugs.
But the way they pay
that was why they call it D.
A, B, C, D, E, F, G.
Sorry, Gerri,
Google bought it last week. Anyway, so the way people pay it is directly out of Social Security. So by law, you can't have your Social Security benefits go down. So that's what would happen with these rising premiums.
But this legislation they're working on,
I'm
sorry, the legislation they're working on, a couple of, they want to make it so whatever you do with Social Security, you do to Medicaid, or Medicare. So if that's getting no increase, then Medicare shouldn't get an increase, right?
That's what they're talking about in the legislation, but there's no sense of how much that would cost, and right now it doesn't have that many supporters, so it's just not clear what's going to happen with that legislation.
That's going nowhere.
It could be a Pelosi-Boehner fix, and if Boehner sticks around, they could just fix it.
That'll be his last thing.
Yeah.
Yeah, one final
Boehner's
deal.
just going to fix everything in his last couple of weeks, right?
Right. Well,
by the way, the hardliners would probably welcome it to get it off
the table, right?
Yeah.
Either that, or why don't we have a better economy? Because then we'd have some inflation, and this wouldn't be a problem.
Why don't we fix the healthcare system? I know why don't we
don't
cure
try that again. Look what happened. Oh my goodness.
All right, I'm going to put all of you in a driverless car and just sort of see what happens.
Driverless car.
All right.
Are you in the ARP yet?
Yes.
Your birthday. You just had a birthday recently.
Look at the time. We got to go.